Former CBS 13 anchor is sharing her story tonight, and thousands of California families hope the governor hears it. A bill sitting on his desk would force private insurers to cover the cost of hearing aids for kids. But it's been here before and failed. Christina is a mom who says going without is not an option for her son.
And despite what their insurance seems to think, though, here's reporter Lauren Toms.
The sounds of the playground are amplified for 6-year-old Jake James. His hearing aids help him hear the world around him.
In order to connect with everybody else and hear what everyone's doing and learn and play, he needs his hearing aids to be like his peers.
Jake was born hard of hearing, and his mom, Christina Jane, says they were floored to find hearing aids would not be covered by their insurance.
To hear that hearing aids weren't covered, we were really surprised because this wasn't something that we just picked out for him to have.
It's estimated that 18,000 children in the state are living with some level of hearing loss. California is one of roughly 20 states that does not require insurance companies to cover the cost of hearing aids. But proposed legislation could change that. A bill has made its way to Governor Gavin Newsom's desk that would require private insurance companies to include coverage for hearing aids in people under 21.
Every 4 years, families pay $4,000 minimally. It's $6,000 on average for hearing aids. Call it either cosmetic or elective, if you can believe that. Because as parents, we're like it's neither.
Otolaryngologist Dr. Dylan Chan says the issue is not only medical, but urgent.
This is not something that can wait. It's not like you can, not have a hearing aid when you're a kid and catch up when you're an adult. Kids really require this access to sound early on in their life from when they're a baby. Otherwise, they really can develop these permanent speech and language and developmental delays.
The National Institute of Health estimates that a child with permanent hearing loss who does not receive help such as hearing aids can cost an additional $1 million in education and other required services.
We're sort of living in that space right now in California where families are having to choose between between paying for a medically necessary device for their child's development and hearing or putting food on the table, right?
For Christina and her family, they budget for the cost early, but know thousands of children are living without help.
You're always thinking about it, and you're thinking about okay, we know that's coming, and for our family, we know that we've been able to do that for Jake, and we will continue to do that for Jake no matter what. But a lot of families don't have the same thing.
It's an issue of health equity, she says, fighting for other children to hear the sounds of the world as her son can, too.
Now, public plans like Medi-Cal do cover hearing aids for minors.
But that only covers about 1 in 10 kids who need them. The governor has until October 14th to sign or veto that bill.